Consider first. Yeah, we gotta wash the hands and do all that, read the chart. Yeah, absolutely, before you put your hands on them. 100%, absolutely. We have to do all that stuff. But, right, what do you think, what else do we need to consider then? After we washed our hands and all that, and read the chart. We've written, okay, they have some pain, but you still need to do some manual muscle testing. What else?
Maybe inspect the area.
Inspect the area. Okay, what are we inspecting for?
Any open wounds.
Any open wounds, anything like that, open wounds. What else? Swelling.
Yeah.
What else?
Discoloration.
Discoloration. Anything else? Somebody's phone. Please put it on vibrate. It isn't distracting. Please put it on vibrate, whoever. Okay, thank you. All right. Okay. All right, so we have swelling, discoloration, redness, anything else?
Weird heat or cold
Heat,
feelings.
cold, anything like that. So you want to do that inspection first, okay? So he's okay. There's a little pain he has. All right. So what else do I need to do? As I'm getting ready to do the manual muscle testing.
Introduce yourself.
Yeah, we have to do, we've done that. We've done all that stuff already. What else?
You have to know the range of motion.
Looking at the range of motion, okay? Anytime you're in the clinic, you always want to do the range of motion first. Because what if they honestly only able to do this? Alrighty? Is that full range of motion? No, they just went here. No. Alrighty? So you always want to do the range of motion first, okay? And you can see in the manual, it's range of motion first always, okay, for each one, after each motion. We're always doing range of motion first, okay? Now, I did my range of motion, okay? And I say I got, I don't know, we'll say 120, all right? We'll say 120 for now, okay? All right, so is that against gravity? I'd ask him to do it against gravity.
Yeah.
Yeah, right? Is that gravity the first line of resistance?
Yes.
Yeah. So what you want to do is always, when you're doing a manual muscle testing, you want to take definitely a gross range of motion first. Look at how they move, right? Looking, are they completing the full range against gravity, right? If they are they using the muscle they're supposed to be using, right? Or is he doing something like this to get it up here, like a little shakiness getting up there, alrighty? And if he is, why? Okay, many reasons. Maybe there's weakness, okay? Maybe there's low tone, whatever the reason. But you want to make sure if you're doing a manual muscle testing, right? Manual muscle testing is looking at the isolated muscle itself, okay? So I'm doing shoulder flexion. I'm looking at what muscle?
Anterior
Anterior deltoid. So I want to look at the strength of the anterior deltoid from the beginning range to the end range. Okay? Right? Right, so for him, if he put his arm at the side, put your arm at the side, is he starting from beginning range?
No,
The
ma'am.
possible of beginning range? No, he's probably, I don't know, whatever, 40 degrees or whatever. Okay, looking at it. So I need to have him in a position, okay, that is gonna allow him to be at the beginning of range and be against gravity. Yes or no? Okay. So where would I be doing it in sitting, standing, or side lying, supine?
You could do it supine.
I could possibly do
You
it
can also
supine.
do it sitting too.
Yeah, I could possibly do it sitting or supine. Would I do it standing? Can I do it standing?
Yeah.
You could,
Yeah.
right? What is better for me now?
Well, he's a big guy, so I guess supine.
Is it?
No, sitting.
Think about it,
Sitting.
right? Because if I have to do range of, give him resistance,
Oh yeah.
okay?
So sitting.
Things, standing
No,
good?
Standing. Yeah.
What about
But sitting though, because you have to provide
Bone.
resistance.
Why bone?
Because if I'm on my stomach, I can still go like that.
That's against gravity.
That's not against gravity though. You're going into gravity at that point. You have to remember, you're going into gravity. There's a difference between going into gravity,
Just
all
get my
right,
head
or
in the
against
tire
gravity.
faster.
All right,
Your
so
veins.
you want to think of
What?
a position, okay, And again, when you're thinking about positioning for doing
Let me
this
get out of
test,
here.
you wanna think about a position where you are not gonna need to stabilize as much, alright? Stabilization is provided by whatever position he happens to be in, alright? Right? And where you are more advantageous to do everything, okay? So you gotta think about that. So if he's sitting here, is it possible? Yeah, alright? For me, what would I do?
Move him to the.
Just looking at him, what would I need to do?
You might need to get
You
up.
gotta
on
slow
the-
I need to get up a little
Sorry.
bit higher,
Yeah.
okay? So thinking of that, that is what you have to sort of start thinking of. If you are, first thing that you're looking at, is he in against gravity position? And if he's in against gravity position, is he actually able to lift it up against gravity in a controlled fashion? Okay? If he's not, alright, if he's having issues controlling the motion, or he's making minimal movement, right, you're gonna need to put him in a gravity eliminated position at that point. Which,
Sideline.
for this one, yeah, would be sideline, okay? Right, after you decide, okay, he has good motion, right, and he has good control, now you really wanna know how strong that anterior delt and coracobrachialis is, alrighty, you're gonna apply resistance, right? When applying resistance, right, you need to put yourself in an advantageous place now, okay? For me, where I'm not gonna be using as much not as much, stress on my body, I have to be at a higher surface, alrighty? So I can be sitting on here, alrighty, right? But if I need to have him in a complete range, have him do from beginning to end of range of motion, can I really sit on this thing?
No.
No, okay? So I have to think about what else can I do?
Move him to the side.
I need to move him aside, and I need to stand on something,
Mm-hmm.
okay? There you go. Right. So sort of think about it. You guys are gonna have all this stuff all around you, okay? Alrighty? Just sort of look under all the tables, okay? Look under all the tables. There's stuff around here, okay? And you're gonna have all this readily when you take the practical. We're gonna have everything there. We're gonna have good chairs, alright? Chairs without wheels or anything like that, alrighty? The plinth is gonna be set up already. You won't have to do the sheet thing, because, you know, that just takes too long after a while. So everything will be there, okay? Everything will be. You just gotta look for it. And it's not gonna be the responsibility of me or Mr. Mitchell saying your body mechanics was not good during tests, okay? Everything's there. You just gotta open your eyes and look for everything, okay? Because those couple of points add up after a while, alright? So, alright? So, alright, so I'm gonna go through the test now, okay? And I'm assuming he's gonna be able to lift it up against gravity when I first walk in, alright? And you are gonna do that, okay? Alright? We'll do. Alrighty, so, oh shoot. Hi Kevin, how are you?
Good.
Good. My name is May. I'm gonna be your physical therapist today, alright? I'm gonna just wanna see how strong some of your muscles are in your shoulder, right? Is that okay with you?
Yep.
And for me to do that, I'm probably gonna need to apply some resistance on you, alright? Do you have any pain anywhere? And he's gonna, whatever you say,
Mm-hmm.
alrighty? And you wanna get all that information in, okay? Alrighty. So can you keep your hand at your side for me? Okay, like, very good, thank you. Alrighty. Now, can you slowly lift your hand up and over your head for me now? Thank you. Keep going, go as far as you can. Alrighty. And I see he's doing it quite well. Okay? Alrighty. So I really want to see how strong he is now. Alright? So I'm gonna add resistance to it. Where do you think I would apply the resistance? On the shoulder here? Distal part of the humerus, okay? You wanna be somewhere distal mid-humeral area, alright? Because if I apply resistance here, I should move, go up. No, go shoulder flat, alrighty? Am I doing anything? No, I'm really pushing down, but I'm not resisting him at all. Alrighty? What am I possibly doing, by the way, if I apply resistance?
Stabilizing.
I'm stabilizing him and possibly preventing him from going more because I'm, giving him a tactile cue for the muscles not to move, okay? So you want to apply resistance always distal. And which direction is the resistance? If he's going into flexion?
Down.
Downward, okay, or into extension. that kind of makes sense, right?
You're going the opposite way.
Yeah, that makes sense, right? If I'm doing internal rotation of the hip, which direction would I be applying resistance?
External.
External, okay, that makes sense, right? Okay, alright, so, alrighty, this time I'm gonna ask you to bring your shoulder up again, okay? Alrighty, and I'm gonna add some resistance. Is that okay with you? Alright, now, before I do that, what may he do if he's able to lift it up against gravity, but he's, having difficulty tolerating my resistance?
Might lean back.
He might lean back. What else may he do?
To the side.
To the side, okay? So you are always gonna be at the position of readiness, okay? Because if I put my hand here to stabilize him, can I interfere with the motion, you think? Yeah, I'm probably gonna interfere. So I'm gonna have my hand stabilizing back here, alrighty? And where am I? Okay.
My lower traps.
Yeah, lower trap, somewhere right around there. In the lower trap area, mid-back area. So I can move it accordingly to where he starts trying to compensate. Okay? Right? He's strong, I'm probably not gonna move my hand too much. Alright? But I will keep it here so I can be at a position of readiness, okay? And he's gonna go into flexion, okay? So his hand is gonna be here, because it's close as can be, into a beginning range, alright? Alright, so, alright, I'm gonna wanna stabilize him through this, okay? So on the count of 3, I want you to bring your arm up into the air again, okay? On the count of 3, 1, 2, 3, go, 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 go. And I'm probably gonna stop the resistance pretty much after 5 seconds, right? As you're letting him go through the range, okay? Remember, you have to let them go through the range. It's not like a brake test where you're just preventing them from going through, right? You want them to go through the range, right? Now, how do I know it was actually the anterior deltoid that did that? What do I need to do?
Feel it.
You gotta feel it. You gotta just sort of palpate it. So I'm gonna adjust my hand position, okay? Because do I only stabilize with my hand?
No.
No, I use my whole arm, trunk, whatever I need to do, because it really depends on the person you're doing the test on. So I'm gonna have my hand here, right? My elbow and my forearm are getting ready to stabilize a little bit, alrighty? And I'm gonna add resistance. I have my fingers here, because I'm just feeling for the muscles to contract now. I'm not palpating the muscle per se. I just wanna make sure I feel some muscle fibers going, and it's not something else taking over, alrighty? For shoulder flexion, like I said, it's the 2 primary ones, anterior deltoid, biceps, and coracobrachialis, right? So I'm gonna adjust my hand position if I wanna feel for the biceps coming into play, alright? For the coracobrachialis also, alright? So I'm gonna spread my hand as much as possible, alright, over that area, and I'm gonna adjust my fingers as needed. So bring your hand back here, okay? Alrighty, so on the count of 3, we're gonna do it again, okay? And I'm gonna add that resistance, okay? 1, 2, 3, go, 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 and I'm gonna feel, and I don't need to stabilize so much, and I feel a little bit in the anterior deltoid. I do feel his biceps coming into play, more for the fact my hand was resisting there, right? But I definitely feel the anterior deltoid and the coracobrachialis. Yes or no, right? Now, he was good. I didn't have to stabilize. He didn't do anything weird or anything. He didn't lean forward, didn't lean back, alrighty, or sideways, alrighty. What else may they do to substitute, you think? If they are able to lift it up against gravity, but they're not able to tolerate your resistance. What else may they do to try to get the shoulder going?
They kind of hike it out.
Well, what do we call that?
Well,
Shrug.
Shrug.
Yeah.
Yeah, they might, shoulder shrug, scapular elevation, right? They might do that. So again, as you're doing this, you're watching him constantly. Are we upsetting him by doing resistance on him, all right? Because you could see right away if he's trying to, do the activity you want, because patients do want to try to please, all right? But you could see if you're causing discomfort, which is very important. You gotta watch out for everything, okay? So you always have to be in a position of readiness where you can keep an eye on him, either directly or peripherally, right? To make sure he's not showing any distress, right? What else do people tend to do when you manually muscle test? Right? If you're giving resistance, what do people love to do all the time? He did it a little bit, by the way. What? A little bit. Well, they like to hold their breath. Is that good?
No.
No, absolutely not. It's not the breath holding that's bad. It's when after they hold the breath and all of a sudden there's a sudden release. Because when you hold your breath, what are you basically doing? Besides holding your breath, right? You're bearing down, right?
Yeah.
Right? When you bear down, you're closing off blood returning to the heart and to the brain. Right? When you bear down. Okay?
Get lightheaded.
And you get lightheaded. It's not from bearing down. It's from all of a sudden the release of all
Right.
that blood rushing back. Right? So you need to be careful. Alrighty? Right? So that's why when you're doing a manual muscle testing, you really don't want to do it for more than 5 seconds. Because after 5 seconds, you pretty much know what type of strength they have. And grading of the strength here is, again, like we said in the beginning, it is subjective sometimes. Alrighty? What you always want to do is think about how much resistance you are giving him. Okay? How much is he tolerating? Okay? And for him, when I instructed him of saying, I'm going to give you resistance, right, and you're going to give it back to me, I'm going to grade it at that fact. For him, he's probably definitely close to a 4 plus over 5 or even a 5 when I was doing it. Alrighty? So be aware, when we're doing manual muscle testing, right, well, they're always going to be this strong. Right? Even if they're, lift against gravity. Or a patient, they're always going to be that strong. If you see them lift up against gravity, right? You're going to want to add resistance, right? But usually, though, they're not going to be that 4 plus out of 5 or 5.
Well, yeah, if they're seeing you for help, they're probably not.
Hmm?
If they're visiting you for help, yeah, then they're
Well,
not
we're
gonna-
safely assuming they're weak somewhere,
Yeah.
all right? Something's happening to them that caused them to come, all righty? Now, if you're doing the wellness part of it, that may not be always 100% true, all right? Because there's a difference they're seeing you for wellness, okay?
Well, if 2 plus is if they're able to do it against gravity, how is the difference between a 3 plus 4 plus 5?
It's subjective, like I said. It is subjective. Because if you're looking at 2, what is 2 again? 2 is? No.
3 is fair.
3 is fair. Alright? 3 is fair. Alrighty? So, 2 would be full range in a gravity eliminated position. Look at that chart. Okay, that's going to be on the test. Look at that chart. Alright? 2 is full range gravity eliminated position. We're going to do that next. Okay? Now, if you're talking about 2 plus, alrighty, people do take liberty with it. Daniels and Worthingham took liberty with it. They consider 2 plus tolerating slight resistance or minimal resistance in a gravity eliminated position. Alrighty? Or they are able to initiate the motion in a gravity dependent position or against gravity position. Alrighty? And they're able to go less than half range. Okay? There is liberty to it. Okay? Unfortunately, so that's why can be subjective. Alrighty? Now, as physical therapists and physical therapist assistants, we always want to increase strength, right? Alrighty? But why are we increasing strength?
Stability.
Huh?
Stability. Or...
Stability, what else? Function. Do something with it, right? So whatever strength you are working on to increase, okay, related to a activity that's important for that patient, okay? To be honest, the insurance company is really not going to care that you went from a 4 minus to a 4 plus. What's it doing? What are they doing? It's important for us because that's how we're going to gauge our plan of care. But the insurance company and the doctors are going to want to say, what are they doing? Kind of thing. So you always want to say, increase strength to, I don't know, whatever, 4 plus, right? For the patient to be enabled to do this, this, and this. Okay? right? Something like that. Don't just write increased strength, they need to know why. Okay, right, and I always tend to err on the lower end, right? Because it's same thing as, remember when I told you when insurance companies see that 100 feet that they walked? So, ooh, they walked 100 feet, they don't need therapy anymore. They don't see the fact that it needed, moderate assistance